Hello everyone, my name is Simranjeet Kaur and I am completing my alternative placement in Fleming College and I am in my fourth semester right now and I am a student of social service worker. So I will be presenting my case file on Callie Jacob. So first of all, I would like to explain about the genogram that I have made about Callie Jacob. Donald Jacob had a marriage with an unknown mother of Kelly and Jude, who is no longer alive. Kelly and Jude are siblings. The straight line and the dotted line represent the committed relationship between Kelly and her boyfriend Wyatt. The red dotted line between Brandon and Kelly represent the love affair they had. The red line with two lines between Steph and Mike represent that they are divorced and they have a son who is Brandon. The straight line between Steph and Lena represents that they are married. The blue dotted line represents that Mariana, Jesus, and Jude are adopted by Lena and Steph. The green dotted line represents that Callie is a foster child of Lena and Steph. Lena is daughter of Dana Adams and Stewart Adams. Sharon Elkin and Frank Cooper is dad of Steph is dead. Who is dead are Steph's parents. And next, I would like to explain about the eco map that I have made for Callie. So, firstly, Kelly has strong and mutually influential relationships with Jude, her brother, Wyatt, who is her boyfriend, Lena Adams, and Steph Adams, who are her foster parents. There is a reciprocal connection between Kelly and Mariana, Jesus, and Brandon. Kelly has a reciprocal or a two-way relationship with Mike. Kelly has a strenuous or challenging relationship with Liam, who is her ex-boyfriend who raped her, and Donald Jacob, her father. There is a single line connecting Kelly and Bill, who is her social worker, which suggests there is a relationship of energy between them. So next is our social history of Kelly. So first of all, the representing problem of Kelly is that the top risk behaviors include her identity issues, the lack of reliable adult role model, and the difficulties of being a foster kid, complex family dynamics, and so these are the presenting problems and her search of her biological family and the discovery of her biological father who was Robert Quinn to the complexity of her current problems. So about the background information of Kelly, Kelly is from a she is drowned in tragedy after her mother tragically died in a car accident caused by her father's drunk driving. Kelly and Jude were placed in foster care because there was no one who would take the responsibility for both of them. Talking about the birth and childhood, Kelly's early years were chaotic, with her brother Jude going through a lot of school changes. And she struggled with growing up, taking on adult roles, and establishing stable relationship because of her family circumstances. Talking about the marriages and significant relationship, Liam is Kelly's ex-boyfriend and Wyatt is her current boyfriend. The main romantic relationship between Kelly and Brandon is a foster sibling relationship that causes heartbreak and issues in the family. And Steph was married to Mike, and they had a child who is Brandon, and living with her mother. And now, after their divorce, Steph and Lena are married now. Talking about gender and sexual orientation, Kelly's gender identity is female because her sexual orientation is not explicitly mentioned, but as shown in the series, she is interested in boys and had two boyfriends. And also she is in love with Brandon, so we can say that she is straight. And moving forward, talking about current living arrangements, Kelly initially lives with Steph, Lena, and her foster siblings along with her brother Jude. She decided to live independently but could not because of the living expenses. And talking about the education, Kelly's study is impacted by her frequent school changes. She and her brother Jude are currently studying at the Anchor Beach School, which is funded, and and her other siblings are also studying there. And talking about the employment history, Kelly was not seen employed in the series. And about the medical history, no specific details about Kelly's medical history are shown in the show, because Hesus was prescribed but Hesus was prescribed some medicine that was vitamins, and Mariana stole medicines and consumed it, as well as she tried to sold them to one of her students. And talking about the behavioral health, Kelly has some mental health issues, including the traumatic experience with Liam, her ex boyfriend, who tried to rape her. Kelly's past experiences have left her emotionally scared, and she often feels it's her responsibility to protect her younger brother Jude, and to protect him, even if that means hurting herself along the way. Talking about the legal history, Kelly had one of the most significant incidents in her criminal history. During a time when she was having financial difficulties due to running away from her foster house, Kelly went to convenience store and purchased some food. And when the store owner asked her for money, she just denied that she doesn't have any money. So that's why he called the police. And talking about the social and recreational activities, Kelly finds comfort in photography, and she uses it as a form of self-expression. And Kelly's social circle revolves around her friends. And so, talking about social location, Kelly's social location is a reflection of her experiences growing up in a foster care. And talking about successes, strengths of and resources of Kelly, Kelly's strength lies in her resilience, especially as she serves as a parent figure for Jude. Her love for photography is a source of self-expression. And talking about formulation, the Foster's first season focuses on Kelly's Jacob, a young girl who doesn't know her biological parents and is going through a foster care. Despite her challenges, Kelly is resilient and works hard to look after her baby boy, her baby brother Jude. Because of Kelly's past, she had hard time trusting people, but gradually she begins to open up. And throughout the season one of these Fosters, Kelly has a lot to learn about herself and struggles to find out who she truly is, and showing strength and courage in times. So, moving forward, the resources and in Peterborough that I would like to recommend for Kelly are Talktown Mental Health and Addiction Clinics, that is in Peterborough Regional Health Center. And because it offers early access to a wide variety of mental health options for people of all ages. And the next one is Canadian Mental Health Association, which is at the Halliburton Kawartha Pine Ridge branch. And they focuses on one-on-one approach to mental health and well-being. And the third resource would be Peterborough Public Health. I recommend the Kelly to PBS because the programs and services focus on multifaceted nature of health, from physical health to mental health. And then after that, Telecare Distress Center of Peterborough. There was recommended by me because it provides a special kind of support that may be especially helpful to Kelly. Moving forward, um, the guidelines that I can relate to Kelly are like, first of all, the Ontario OCSWW SSW or MHAW guidelines. That would be the first would be maintaining the best interest of the client and respecting the intrinsic worth of individuals, carrying out professional duties with integrity, and protecting client confidentiality. After that, I have developed a behavioral support plan for Kelly, in which we have seen that presenting problem of Kelly is, as we have already mentioned in our social history, that multitude of issues that stem from Kelly's experiences in foster care system, trauma, emotional dysregulation, and difficulty forming safe attachments. So, description of challenging behavior. First of all, it is um, firstly, it is self-injurious behavior, like and then threat to others. So contribution, when challenging behaviors are more likely to conditions when the challenging behaviors are more likely to occur, it is the Precipitating factors would be the transitional stresses like living in a new home, adjusting to a new routine, or changing caregiver arrangements can lead to challenging behaviors. And antecedent events that are such as triggers. Kelly Jacobs problematic behaviors are often triggered by specific events that precede her responses. For example, conflict situations such as fighting with friends or family members can cause Kelly to experience heightened emotions. And for Kelly, our behavioral support plan would be for anxiety, it would be creating a safe place for Kelly to express her feelings, and defensive, and we will be set clear limits and boundaries to provide structure guidance to help Kelly regain her control. And next is our SMART goals, the seven domains of care. And first of all, the talking about identity. SMART goal of for identity would be Kelly will be active in the community by volunteering at a shelter or community center twice a month. She will also explore her culture and spirituality by going to cultural events and seeking advice from her social worker Bill on how to reconnect with her culture. And as we can see, there are tasks required that we have mentioned in our presentation. Next is the family relationships. In that, by attending family therapy twice a week, Kelly will be able to develop trust and communication skills with her foster parents, Steph and Lena, and her siblings, Mariana and Jesus. After that, the third one, social relationship and supports. The goal would be Kelly will speak up and connect with her classmates at school in college with the goal of making at least two lasting friends before the end of the school year. She will also ask her school counselor for advice on social skills and networking. As further, we can also see the task required, evaluation criteria, and time frame in our presentation. The fourth one would be for the physical and medical health. Kelly will focus on her physical and mental health by going to all appointments, taking her prescribed medications, and exercising and eating right. The next one would be social and emotional development. Kelly will work on social and emotional growth by participating in peer groups, expressing her feelings in a positive manner, and participating in therapeutic programs suggested by her counselor. And next one is education progress. Kelly will work on attending all classes on time, getting her assignments done, and asking for extra help from her or resources to help her grades and overall academic performance. The seventh and last goal would be Kelly will learn how to be independent and take care of herself by doing chores and around the house, taking care of her personal finances, and being able to make decisions about her life and future. The next part is for Callie, a service recipient from the fosters. The following treatment recommendations are tailored to address her needs and help her move forward in the Peterborough area. First one would be individual counseling at Kavartha Sexual Assault Center. Individual therapy with Kelly may help her work through her past trauma with Bill. With her ex-boyfriend Liam, who tried to rape her. And next one would be group theory at four countries addiction service team, which is also called Forecast. At Forecast, Kelly could attend group therapy sessions to work on substance use problems and connect with other individuals struggling with similar issues. The next would be family therapy at Peterborough Regional Health Center. Kelly's Foster's family therapist can help her navigate interpersonal dynamics, improve communication skills, and foster stronger family connections. And the fourth one would be art therapy at Canadian Mental Health Association. Um, uh, and Pine Ridge, Kelly can at Kavartha, Pine Ridge, Kelly can find comfort and expression through CMHA art therapy sessions. And the fifth one would be community outreach program at Friendship Center. Kelly could also benefit from community outreach program offered by the community center, such as cultural training, ceremonies, and healing circles. The last and sixth one would be Life Skills Development Program at YWCA Peterborough, Halliburton. By enrolling in YWCA Life Skills Program at Halliburton, Kelly will gain life skills that will help her independently and thrive in the future. So that was all my presentation. Thank you so much.